We are live. We are broadcasting from the beautiful and cozy Stone Cottage Studios in North Boulder, Colorado. Welcome to Ask an Expert. Thank you for joining us tonight, December 7th, 2022. It's a chilly night outside, and we have a lovely little fire to support our discussion and safe, comfortable spaces for talking about some of the heavy stuff we'll be discussing tonight. My name is Amanda Wroblewski, and I am the program coordinator for the PILLAR program at Boulder Community Health. PILLAR is an acronym for Prevention and Intervention for Lifelong Alternatives and Recovery. And what we do is provide service navigation, short-term case management, and some limited scholarship dollars to help folks find treatment for the management of substance use disorders or chronic pain without the use of narcotics, as well as doing community education. We get all of these wonderful opportunities through various grants through the City of Boulder, as well as our BCH Foundation, so I want to shout them out as well. But once again, I want to welcome everybody who's joined us tonight, either for the live stream or the recording. Either way, it's a great way to get the information. And tonight we are going to be talking about HIV. What is prevention? What has the historical stigma been around HIV/AIDS and other infectious diseases like Hep C? We are super excited to welcome Mariah Frank, who is the prevention director with the Boulder County AIDS Project, and I will let her talk a little more about her role and her experience, as well as BCAP as an organization. But before I do that, I just want to set an expectation for the evening and remind everyone that, like I mentioned, these are really heavy topics that we discuss, and these are really big things that we are working in little microcosms to address and provide services for the people that are struggling with substance use disorder, chronic disease, chronic pain, mental health, trauma, all of these really large public health issues. But that is, again, the beauty of things like Ask an Expert and providing the education and talking about the services, because there's really a lot of amazing work being done. That being said, not any easy answers to any of this. So in this 45 or so minutes, we are going to talk about these specific services and this specific organization, and how getting connected to BCAP or to PILLAR or any of our other fabulous community partners can hopefully be a step on a recovery journey for folks, or a step in the direction to make better healthcare choices for you, for a loved one, for someone you know that may be struggling. There will be a resource slide at the end that'll have my contact info, Mariah's contact info, the general number for the Boulder County AIDS Project, and as well as websites. So everything pretty accessible. And certainly, if you're joining us live, join the discussion. Let's talk. Let me know what's on your mind. I will, as always, be the disembodied voice facilitating and monitoring the chat and the questions. So please feel free to chime in. We'll have about 10 or so minutes at the end, but we can also, at any point of the discussion, jump in with some questions or some thoughts. So just enter them in the chat box to the right of your screen. And if you've got a minute, live stream, recording, fill out the survey. It only takes 2 minutes. I want to hear from you. It helps inform the kind of presentations we bring, and, gets me potentially connected to some new speakers and just more fresh information, anything that we can support community ed and public health with. So with that, give us just 1 second, and Mariah will take this spot and she will take it away. Thank you.
successfully executed the swap. So hi everyone, my name is Mariah Frank. Like Amanda said, I'm the prevention director at the Boulder County AIDS Project. And I'm super excited to be here tonight. I have what feels like a pretty long background in HIV prevention and in harm reduction. I sort of found a passion for HIV prevention and sexual health when I was in college doing some peer health education work. And that has sort of stuck with me for my time since. Most recently, I did a lot of work through my master's in public health for really surrounding healthcare and policy and health choices for people who use and inject drugs and people living with HIV. That was back on the East Coast where I'm from, and I moved out to Colorado about a year and a half ago. And I am so excited to be here and be with the Boulder County AIDS Project doing this work every day. So with that, I'm going to go ahead and jump in. So the first thing I wanted to highlight for everybody a little bit in our discussion was the Boulder County AIDS Project and what we do on a day-to-day basis. So the Boulder County AIDS Project is a nonprofit organization located here in Boulder, but we serve Boulder, Broomfield, Gilpin, and Clear Creek counties and have been doing so since 1985. And at the Boulder County AIDS Project, we sort of have these two buckets of services. So the first essential service that we offer is our care services. And our care services tend to work with people who are living with HIV to help make sure that all of their needs are being met. So one of the services that I want to highlight that does this is our food pantry. We do have a food pantry at BCAP where our clients can come and grocery shop completely for free twice a month. We also offer other pro bono services to help address our clients' overall wellness needs. So currently and in the past, we've offered and facilitated access for our clients to have acupuncture therapy, massage therapy, legal services, mental health services to help make sure their overall wellness needs are being met. And then lastly, we also have a staff member whose whole job is dedicated to making sure that our clients have health insurance that's right for them to ensure that their medical needs are able to be met and provide some financial assistance for their HIV care and treatment. The second half of BCAP services, which is the half that I work in, is our prevention services team. And our prevention team predominantly works with people who are not living with HIV to help prevent HIV transmission. And we do this through a number of services as well. The first that I want to highlight is our testing service. We're going to talk about testing pretty extensively later, but BCAP does offer free HIV testing to anyone who wants to come in and get tested. We also provide educational services, so we are partnered with local school systems and school districts to supplement education in the schools with HIV 101 education. And we also do outreach services, so we'll go into the community to festivals or events and table there to share information about HIV care or prevention and just the work that we do at BCAP every day. So that's a little bit about us. Before we keep going, I just want to do a brief overview of sort of the stuff we're going to cover. So we're going to have some background info on HIV and on AIDS, as well as discussing the differences between those two things. And then we're also going to cover how HIV is transmitted, how we can reduce our risk for HIV transmission, how we test for HIV, and then what HIV treatment currently looks like. So now that you have some background on BCAP, I also wanted to give some background on the HIV epidemic and what that looks like in the world today. So HIV has been considered a global epidemic since the 1980s. And since the beginning of the epidemic, the World Health Organization estimates that about 75 million people have been diagnosed with HIV. Currently in the world today, it's estimated that there are about 38 million people worldwide known to be living with HIV. So thinking through the numbers, that's about 50% of all the people who have been diagnosed with HIV since the beginning of the epidemic are still alive and living in the world today. If we zoom in a little bit and look just at the United States, there are approximately 1.2 million people in the US who are known to be living with HIV. And each year, the US experiences a pretty consistent rate of new diagnoses every year. And each year, we see about 38,000 people newly diagnosed with HIV. And of those approximate 38,000, about 1 in 5 is someone under the age of 25. Lastly, if we just look at our state here in Colorado, there are approximately 15 to 17,000 people known to be living with HIV in Colorado. And a big thing I like to highlight here is that all of my numbers are estimates. I don't have perfectly exact data for how many people are living with HIV. And that's because 1 in 7 people who are living with HIV don't know that they have it. So oftentimes, someone can be living with HIV for long periods of time and they may not feel sick, they may not feel symptomatic, they won't look sick to someone, and so they won't go in and get tested. And so oftentimes 1 in 7 people are living with HIV and don't know it. So that's why we don't have perfectly precise data for how many people around the world, in our country, or in our state are living with HIV. Now that we have some background, I want to go through quickly and define what exactly HIV is. So HIV is an acronym that stands for Human Immunodeficiency Virus. And each part of this acronym tells us a little bit more about the virus. So the H stands for human, and this is really important because HIV is exclusively a human virus. So it can't exist in any other animals, it can't exist in any insects, and it cannot be transmitted or contracted by or from other animals or insects. It's exclusively a human virus and can only be transmitted from human to human contact. The I stands for immunodeficiency. And if we break this word in half, the first half, immuno, is referring to our immune systems. And the second half, deficiency, means something is weakened or not working properly. So what this is telling us is that HIV is attacking our immune system and making it weaker. And then the V in HIV stands for virus. Typically, when we're talking about infections, we're talking about 2 types of infections. There are bacterial infections and there are viral infections. The main difference between these two is that bacterial infections are curable and viral infections are treatable. So if someone gets a bacterial infection, they can go to their doctor, get an antibiotic, and be completely cured of that infection. But when it comes to viral infections or viruses, we typically have no cure. And that's what's true for HIV. HIV is a virus, and currently in the world today, there is no cure for HIV. Scientists and doctors are working on it, but we just haven't gotten there yet. So what this means is that if somebody is diagnosed with HIV, that is a lifelong diagnosis at this time. It is a chronic illness. However, even though we do not have a cure, we do have really amazing treatment that we're also going to talk about a little bit later. And this treatment helps make sure that people living with HIV can manage and suppress the virus and live long, healthy lives. So now that we've defined what HIV is, I'm going to talk a little bit about how it actually works in our bodies. And to do that, I want to talk specifically about our T cells. And our T cells are a very specific part of our immune system. Our T cells are sort of the leaders of our immune system. And what they are able to do is they are able to detect when there are infections or intruders in the body. And then they can tell all of the other white blood cells or the other parts of our immune system to go and fight that infection. When somebody has a strong, healthy immune system, they will have a T cell count of 800 or more, generally maxing out around 1,500 T cells. And a T cell count is the amount of T cells that someone has in a drop of their blood. So a healthy T cell count is 800 or more in a drop of blood. Now, when we say that HIV is attacking our immune system, specifically what HIV does is it attacks these T cells. And so what happens is when someone has been exposed to HIV and HIV gets into their bloodstream, HIV is going to work to invade and hijack these T cells. And when HIV hijacks a T cell, it completely rewrites the purpose of that cell and turns it into this sort of virus-producing factory. So a T cell that's been hijacked by HIV can no longer tell other white blood cells what to do. It can't detect infections in our body. All that hijacked T cell knows how to do now is make more copies of HIV. Once that hijacked T cell has made enough copies of the virus, HIV destroys that T cell. And once that T cell is destroyed, all of the copies of the virus that got made go off into the body, find other T cells, invade those T cells, and this process repeats itself over and over and over again. So over time, as someone is living with HIV, if it is left untreated, more and more of that person's T cells are going to be destroyed. And if someone living with HIV has a T cell count that drops below 200, so 200 or fewer T cells in a drop of their blood, that person can then be diagnosed with AIDS. So now, just like we did with HIV, we're going to go through the definition of what exactly AIDS is. AIDS, like HIV, is also an acronym. And AIDS stands for Acquired Immune Deficiency Syndrome. And I'm going to break this down just like I did with HIV. So the A in AIDS stands for acquired. What this is telling us is that over time, if someone is living with HIV that is left untreated, more and more copies of the virus are being made. And so the amount of virus in that person's body is going to start to build up. So over time, they can acquire a lot of the virus in their system. We already talked about immune and deficiency. We know that HIV attacks our immune system and makes it weaker. And then the S in AIDS stands for syndrome. This is really important because AIDS itself is not a virus. AIDS is not an infection. You cannot transmit AIDS to someone else. You cannot contract AIDS from someone. AIDS is a syndrome, and a syndrome is defined as a collection of symptoms, oftentimes symptoms that we may not be able to see. The symptoms that someone must have in order to be diagnosed with AIDS is they need to be living with HIV and have a T cell count below 200. So in defining what AIDS is, this is a really important start to the conversation of what the difference is between HIV and AIDS. A lot of the times, especially now that the epidemic has been going on for a long time, there's been a lot of misinformation about HIV and AIDS. Some of the understanding has left. People often talk about HIV and AIDS like they're the same thing, or they use the terms interchangeably. But HIV and AIDS are specifically different, and so it's really important that we know those differences so we're able to talk about them accurately. The first piece of this is that when we're talking about HIV, HIV is the virus itself. HIV is the thing that can be transmitted between human beings. Additionally, when we say that someone is HIV positive or they're living with HIV, all that means is that the person has HIV in their body, but someone can be living with HIV and not have AIDS. We can think about AIDS like the advanced stage of HIV. So HIV is the virus that causes AIDS. If someone is living with HIV that is left untreated, over time, the virus is going to progress and destroy more and more of that person's T cells and ultimately progress to become AIDS. Now, this process doesn't happen automatically. In general, the average amount of time it takes for HIV that's left untreated to progress and become AIDS is about 10 years. Now, that's an average, so for some people it may happen sooner if it's left untreated. For some people it may take longer, but on average it's about a decade. And another important piece of this is the aspect of HIV being left untreated. Because if someone is living with HIV and they're on treatment, they're taking medication for their HIV, that medication suppresses the HIV virus and boosts that person's immune system. And by doing these things, the medication effectively stops HIV from progressing to AIDS. Another important factor in the difference between HIV and AIDS are these things called opportunistic infections. And opportunistic infections, put simply, are just infections that take advantage of the fact that someone has a weakened immune system. It's easier for something to make us sick when our immune system is suppressed versus when it's strong. And typically we see opportunistic infections like the flu or pneumonia or tuberculosis. These are things that when our body has a strong, healthy immune system, it can either fight off on its own or with the help of some medications from a doctor. But for someone who's severely immunocompromised, like someone who's living with untreated HIV or AIDS, these opportunistic infections can actually prove to be impossible to fight off. Their immune system is too suppressed to fight off one of these opportunistic infections, and that person can end up passing away from one of these opportunistic infections since their immune system is too weak to fight the infection. Lastly, opportunistic infections hold the key to the second way that someone can be diagnosed with AIDS. The first way we said was if someone's living with HIV and has a T cell count below 200. The second way that someone can receive an AIDS diagnosis is if they are living with HIV, have a T cell count below 500, and then at the same time have one of these opportunistic infections. That is another way that someone can receive an AIDS diagnosis.
Hey, Mariah, we've got a question.
Yay!
Can somebody who is living with HIV and then diagnosed with AIDS, but let's say then their T cell count goes back above that 2 or 500, can they go back to just having HIV?
Yeah, this is an awesome question. So, yes. Although HIV is a lifelong diagnosis, AIDS isn't necessarily. So if someone's living with HIV, it progresses and becomes AIDS, and then that person starts on HIV treatment, that treatment does the exact same thing because it's treating the HIV in the person's body. So it's going to boost that person's immune system and suppress the virus, which is going to boost up their T cell count. So they'll no longer have the qualifications, they'll no longer have symptoms that define the syndrome of AIDS. And additionally, when someone reverses their AIDS diagnosis, their immune system will no longer be incredibly suppressed. They'll be healthier and stronger and be able to live and manage an HIV diagnosis. Awesome question. I love that one.
Thank you.
All right. So now we're going to shift gears a little bit and talk about how HIV is transmitted. And first, I'm going to cover sort of the science behind how transmission works. And the first thing that's really important to remember when it comes to HIV transmission is that HIV is a human virus. So again, it's only transmitted by person-to-person contact, one human being to another human being. A big piece of misinformation that was spread pretty widely and rapidly about HIV over the years was that things like mosquitoes could transmit the virus. People were worried that if a mosquito bit someone living with HIV and then flew off and bit someone else, that the virus could be transmitted that way. Fortunately, this is completely false. Mosquitoes cannot transmit HIV. HIV, again, cannot exist in any other animals or insects. It only exists in human beings, so it can only be transmitted from person-to-person contact. And in fact, HIV is only transmitted through 4 bodily fluids. These bodily fluids are blood, semen, vaginal fluid, and breast milk. So these 4 fluids and only these 4 fluids transmit the virus, which means all of our other bodily fluids like sweat, saliva, tears, urine, feces, vomit, any other bodily fluid that someone may be able to come up with, cannot transmit HIV. It's only these 4. And the way that this works is one of these bodily fluids containing the virus would need to leave the body of a person living with HIV and come into direct contact with another person's bloodstream. And this can happen one of 2 ways. The first is through a mucous membrane. Mucous membranes are just partitions between the outside world and the inside of our body and our bloodstream. And we have mucous membranes in our eyes, our nose, and our mouth, as well as in the vagina, the anus, and the urethra of a penis. Those 6 places is where there are mucous membranes on the human body. And so if any of these bodily fluids containing HIV were to come into contact with one of those mucous membranes, that mucous membrane could provide access to that person's bloodstream for HIV to transmit. The second way that this can happen is through direct access. If someone has a cut or an opening in their skin, and any of these bodily fluids were to get into that cut, that would provide direct access to a person's bloodstream and could potentially transmit the virus as well. Now, the last thing, which is probably one of my favorite pieces of information to share with people about HIV transmission, is to emphasize that HIV can really only survive and exist inside of a human body. It's super fragile outside of a human body. And in fact, the virus will completely deactivate if it's exposed to air for 4 seconds. So if any of these bodily fluids containing HIV were to leave the body of a person living with HIV and come into contact with the air, all of the virus in that sample of fluid is deactivated after 4 seconds. And when HIV deactivates, it can no longer transmit. Now that we've talked about the science of how transmission works, I wanted to share a bit about behavioral transmission. And first, I want to talk about the 2 most common ways HIV is transmitted. The first and most common way that HIV is transmitted is as a sexually transmitted infection or an STI. And HIV can be transmitted through oral, anal, or vaginal sex. When it comes to oral sex, if somebody has a cut or an opening in their mouth of any sort, so if they have a cut in their mouth, or if their lips are chapped and cracked and open, or if they have an open cold sore, or maybe they just got done brushing or flossing their teeth and their gums are a little open and bleeding, those are all openings or breaks in the mucous membrane that's in our mouths. And so if that person has any of those cuts or openings when performing oral sex, and any of those bodily fluids containing HIV are also present, that could potentially transmit the virus through the broken mucous membrane in that person's mouth. When it comes to penetrative vaginal or anal sex, there's an increased risk for HIV transmission and exposure. That's because the walls that make up the anus and the vagina are made of a very thin mucous membrane. And during penetrative sex, there can be a lot of friction, and this friction can cause what are called micro tears in that mucous membrane, which are just very small tears that someone may not know that are there or feel, but these are openings or breaks in that mucous membrane. And so if during penetrative vaginal or anal sex, there's any of those micro tears and any of those bodily fluids containing HIV are also present, HIV could have access to a person's bloodstream through that mucous membrane and those micro tears. Lastly, for the insertive or penetrative partner during anal and vaginal sex, there's a natural reabsorption process that occurs after ejaculation. And so if ejaculation occurs in either the anus or the vagina and any of those bodily fluids containing HIV are also present, those fluids could be reabsorbed back into the urethra of the penis. And we know there's also a mucous membrane there. So that mucous membrane could potentially provide access for HIV to get into a person's bloodstream and transmit. The second most common way that we see HIV transmitted is through sharing needles. Now, typically when people talk about sharing needles, they're often referencing sharing needles for injection drug use. But what I really want to emphasize is that it's not drug use itself that puts someone at risk for HIV transmission. It's sharing needles. So this could be sharing needles for any reason. It could be for illegal injection drug use, but it could also be if someone is prescribed an injection or a medication. I often get questions about things like piercings and tattoos. Anytime one person is using a needle and someone uses that same needle after them, there could potentially be a risk for HIV exposure, regardless of what that needle is being used for. That's because at the tip of a syringe, there is an area, a really small area, that is both airtight and vacuum sealed, so no air is passing through it. And if there's any blood contained in the tip of that needle, and if that blood contains HIV, HIV can actually survive in that blood for up to 3 weeks. So we go from HIV deactivating in air after 4 seconds to HIV being able to survive there for a much longer period of time because there's no air passing through to deactivate it. So if one person uses a needle and that person is living with HIV, and someone else uses that same needle after them, even if it's unintentionally, even if it's a week or 2 weeks later, that second person could potentially be at risk for HIV transmission since HIV would still be active in the tip of that needle. There's also a couple of ways where HIV transmission used to be more common, but we don't really see them anymore thanks to advancements in how we practice medicine and science and technology. The first of these is parent-to-child transmission. Parent-to-child transmission can occur during vaginal birth and breastfeeding. Fortunately, parent-to-child transmission is steeply declining here in the US, and that's for a number of reasons. The first is that anytime anyone is pregnant in the US, they are automatically tested for HIV at least once during that pregnancy. And if their HIV test were to come back positive, they would be automatically started on HIV treatment and medication to keep their immune system strong so they can have a healthy pregnancy. Additionally, for people who are pregnant and living with HIV, it's recommended that they can opt for a C-section rather than a vaginal birth and opt to use baby formula rather than breastfeeding. And by taking all of these precautions and prevention methods, 98% of babies that are born to a parent living with HIV are born HIV negative or are born without the virus. So we are very good and getting better at ensuring that parent-to-child transmission for HIV isn't occurring. Another example for this is blood transfusions. So prior to the year 1986, donated blood in the US wasn't really being tested for HIV. So it was entirely possible, and it did happen, that people would contract HIV through a blood transfusion. But now, after the year 1986, all blood donations in the US are tested for HIV. And should any donated blood come back positive for HIV, they would not use that blood in a blood transfusion.
Would they alert that person?
I imagine yes.
Yeah.
I've gotten that question before so if someone donates blood and it comes back positive for HIV and they didn't know that they were living with HIV,
right.
I imagine they have to notify them.
Right.
I can't imagine they don't.
I haven't given blood and I can't because I get tattoos, but which again, silly because the blood supply is safe.
Yep.
But I assume it's on the paperwork and all of the screenings prior to. But yeah, if you, as you mentioned, are unknowingly living with the virus, then having to make that call would be. Another
question I've gotten is, if they get donated blood that tests positive for HIV, what do they do with it?
Oh yeah, good question.
And I
destroy it, just
I said either they destroy it in biohazard, or maybe someone in the medical field has a use for it in terms of looking for new medications and cures and things like that. But I think the likelihood is that they destroy it in biohazard.
Yeah, that's a good question. We should ask, shout out BCH, BCID docs and staff. We should ask one of them.
If one of you happen to know or are online right now, throw it in the chat. What happens? And then a final example of a mode of transmission that we're not seeing so much anymore is occupational exposure. So occupational exposure can occur for people typically who have occupations in the medical field, or who work in hospitals or clinics, who could potentially be exposed to HIV through an accidental needle stick, or if improper precautions are taken during surgeries. But fortunately, we now have an awesome medication called PEP. And PEP stands for post-exposure prophylaxis. Prophylaxis meaning preventative, post-exposure meaning after an exposure. So this is a medication that somebody can take if they believe they've been exposed to HIV. PEP needs to be started within 3 days of that potential exposure. That person then takes PEP for 28 days. And at the end of 28 days, if PEP is taken as prescribed, it's up to 80% effective at preventing HIV transmission. Now, what's really important to know about PEP is that you don't have to be in the medical field to access it. Anybody can access PEP. And we typically recommend that people go to either an urgent care facility or an emergency room to access PEP. And that's mostly because urgent cares and emergency rooms are going to have faster turnaround times. And the thing about PEP is it works better the sooner you start on it. So it's better for someone to start on PEP within the first 24 hours as opposed to 48 or 72. There's also a laundry list of ways where it's absolutely impossible for HIV to be transmitted, and we really like to highlight these because it's really destigmatizing. These are really important because if blood, semen, vaginal fluid, or breast milk aren't present, it is impossible for the virus to be transmitted. So that means that the vast majority of things that we do in our everyday lives with the people in our everyday lives cannot transmit HIV. Typically, we refer to these things as casual contact activities, and casual contact activities do not transmit the virus. So these are things like basic physical contact. So hugging people, high-fiving, shaking hands, things like that can't transmit HIV. Since HIV is not transmitted through saliva, things like kissing or sharing food, sharing drinks are never going to transmit the virus. HIV isn't airborne, so you can't contract or transmit HIV just by being in the same room with someone. Sweat doesn't transmit the virus, so things like contact sports cannot transmit HIV. And again, just to emphasize that insects cannot transmit HIV. And these are really important because especially at the beginning of the epidemic in the 80s and 90s, people living with HIV were being completely isolated from their friends, their families, their loved ones, because we didn't know at the time how the virus was transmitted. And so people were very, very scared of going near their loved ones who were living with HIV. And so a lot of people living with HIV became pariahs, and it was very lonely and very scary. But we know now that people living with HIV can have healthy, normal relationships with everyone in their lives. And it's really destigmatizing and really important that we know that the vast majority of things we do every single day cannot transmit the virus. Mm-hmm. Now that we've talked about transmission, I want to highlight some more risk reduction and how we can prevent HIV transmission. The first thing we always talk about when it comes to HIV transmission is abstinence. And abstinence just means not do something. So predominantly, if someone isn't having sex or sexual contact and they don't use or are not around needles for any reason, that's a near 100% way to ensure that that person probably won't be exposed to HIV. But we also recognize that not everyone chooses abstinence. It isn't a choice for everyone. And so we also want to highlight a lot of other great risk reduction tools. The first, when it comes to sex and sexual contact, we always recommend using condoms during sex. Condoms are a great physical barrier between your body and the virus. And we also recommend using water-based lubrication with your condoms. What lubrication will do is it reduces the amount of friction present during sex. And less friction means less micro tears, and less micro tears means less risk for HIV transmission. You want to make sure it is water-based lubrication. You do not want to use anything oil-based. So no Vaseline, baby oil, oils you find in your kitchen, any lubricants that say they're made with oil, because oil will damage and break a condom. And if a condom is broken or damaged, it doesn't provide the same protection against HIV. Testing is another great risk reduction tool. I'm going to talk about testing super in depth on the next slide, so I'm sort of going to gloss over it for now. But testing as a risk reduction strategy is really important because knowing your HIV status can help you make decisions around what other HIV risk reduction tools you want to use. Open communication is a great risk reduction strategy, and by this, I just mean being able to talk openly and honestly and accurately about HIV with people in our lives. So friends, family, partners, spouses, whoever, the more we talk about HIV, A, the more we know. And the more we know, the better we're able to protect against HIV transmission. And B, the more we talk about it, the more destigmatized it is. And when HIV is destigmatized, it helps people gain access to testing, to treatment, to finding avenues to help increase HIV prevention and care. And so open communication and talking about it is really important. We already noted that for people who use needles, we generally recommend that they do not share those. And people who use and inject drugs can access what are called syringe access or syringe exchange programs, which I know have been talked about on these Ask the Experts before. Places where people can go and get new unused needles so they don't have to share and can reduce their risk for HIV. We said that for people who are pregnant, they can opt for a C-section and use baby formula instead of breastfeeding. We talked about PEP, or post-exposure prophylaxis, for people who believe they've been exposed to HIV in the past 3 days. And there's also this awesome medication called PrEP. And PrEP stands for pre-exposure prophylaxis. So PrEP is a medication that is taken by people who are HIV negative, who are not living with HIV, to protect against HIV transmission. PrEP typically is a daily pill, so it's one pill once a day, although recently, in the past year, an injectable version of PrEP has been approved and is rolling out, and that right now is an injection every 2 months. So you have options. They're working on the rollout. It's a whole thing.
I mean, that's fantastic, though, to talk about access. And
Yeah.
Taking a pill every day is hard.
Yes. And so the way PrEP works, when taken as prescribed, daily pill or injectable, what PrEP does is it creates a shield around a person's T cells. And what that means is that if that person were to be exposed to HIV, HIV isn't going to be able to get into their T cell because their T cells are protected. And so if HIV can't get into a T cell, it's completely powerless. It can't do literally anything else in the body, which means PrEP has effectively stopped HIV transmission. PrEP is safe for anyone over 77 pounds to take. And in the state of Colorado, you just need to be 13 years old or older to access PrEP. And PrEP can be accessed with or without health insurance. So the vast majority of ACA compliant health insurances are required to cover PrEP and the cost of a PrEP prescription. But if someone is uninsured or underinsured in the state of Colorado, we have the state drug assistance program that will cover the cost of PrEP for that person so people can still access PrEP for free.
Incredible.
It's awesome. When PrEP is taken as prescribed, it's 99% effective at preventing HIV. So it is one of our best tools for HIV prevention. And it is recommended, because it works so well, that anyone who is sexually active talk to their doctor about PrEP to see if it's a good fit for them and their sexual health and their HIV prevention. So, like I said, we're going to talk about testing. I have done a lot of HIV testing in my life. And the current way that we test for HIV at organizations like the Boulder County AIDS Project and organizations like us nationwide, most people are using what's called a finger prick rapid test. So when we test you, we just prick the tip of your finger, like if you've ever, or you or someone you know has ever tested their blood sugar. Prick the tip of someone's finger, take a very small amount of blood, and the test runs in 20 minutes. If at the end of that 20 minutes, you can sort of follow along with what results look like at the bottom of the screen here. If at the end of 20 minutes, we always want to see one line in this top box. This is our control line and lets us know that the test ran correctly and we can move on to looking at our results. If at the end of 20 minutes, there's no line in either of the other two boxes, this tells the test counselor that this test didn't detect HIV antibodies or antigens, so no response from our body against HIV and none of the virus itself. Didn't detect any of that in the person's blood, and so this would be a non-reactive or a negative test. However, if at the end of 20 minutes we see one line in the bottom box, one line in the middle box, or one line in both, This indicates that the test did detect either HIV antibodies, antigens, or both, and this would be a reactive or a preliminary positive test. And we call these preliminary positives because these tests are 99.9% accurate. So they're very good at determining whether or not someone is living with HIV. But statistically, 99.9 means that 1 in 1,000 of these tests could be a false positive. So anytime we receive a preliminary positive result, we err on the side of caution and we have that person go in for a second confirmatory test. This test is a blood draw that is even more accurate than our test technology, and this confirms whether or not our test was accurate. Important for HIV testing, HIV has a 3-month window period, which means it can take up to 3 months after an HIV exposure for HIV to be detectable on one of our tests. So if someone believes they were exposed to HIV tonight, we would actually recommend that they wait 3 months to come in and get tested. After that 3-month window period, we are able to guarantee the accuracy of our test results for picking up on that potential HIV exposure. Just like with PrEP in Colorado, you need to be 13 years old to be tested for HIV, and this can be with or without a parent or guardian's consent. At the Boulder County AIDS Project, our testing is completely free and confidential. And lastly, the recommendation for HIV testing is that anyone who is sexually active should be tested for HIV at least once a year. Generally, we are under testing for HIV pretty drastically. People are not getting tested for HIV as frequently as is recommended. So this is a shameless plug to get tested once a year for HIV.
Mariah, can you talk a little bit about the difference or explain the difference between confidential and anonymous HIV testing?
Yes, I can, I think. So when we say we test confidentially, when a person comes in to get tested, we do still collect information from that person. So not only do we go through screeners and things like that to determine their risk for HIV and their sexual health, but we do ask for their name, their contact information, and this is mostly so we're able to get back in contact with them should anything come back reactive, so that we're able to link them to services and resources and care. Testing anonymously would mean that we don't collect any of that information. And the reason we don't do this is because we do want to be able to get back in contact with someone and link them to resources should a confirmatory test come back positive. Additionally, we say confidential because we, along with many other testers at nonprofits like the Boulder County AIDS Project, are mandatory reporters. So for the vast majority of things we talk about in a testing session, we cannot talk about them outside of that testing session. So anything we talk about as well as test results, we can't talk about with anyone else without explicit written permission in the form of an ROI or a release of information, unless someone were to disclose threats to themselves, others, elder abuse, or child abuse. Those we are mandatory reporters for. And we make that really clear to people during our testing consent process so they know exactly what we mean when we say confidential testing, and should they wish to opt out at any time, they are able to.
Great, thank you.
Yeah, no problem.
And just to be mindful of time, we have
Yes.
about 10 more minutes.
Awesome. I got one more topic. So we
Perfect.
should have like 5-6 minutes at the end.
Great.
So lastly, I also wanted to highlight what HIV treatment looks like now, because HIV treatment has come so long and so far since the 80s and 90s when we didn't have treatment, or we had treatments that made people really sick even though they're treating their HIV. So the current treatment regimen for someone living with HIV is known as HAART, and HAART stands for Highly Active Antiretroviral Therapy. And the way that HAART works is it attacks HIV at multiple points in the virus's life cycle and stops it. So what this does is it gives our healthy T cells that have not been hijacked by the virus more time to replicate themselves rather than replicating HIV. And by doing this, someone living with HIV can have a high T cell count and a low viral load, or a low amount of the virus in their body. When someone has that high T cell count, healthy, over 800, and a low viral load, they can achieve what is called being undetectable, which means even though they are living with HIV, we can't detect it on one of our tests. And the Centers for Disease Control, or the CDC, has said that if someone is living with HIV and they are undetectable for the virus, they have also achieved what is called U equals U. And this is one of my favorite things to talk about when it comes to HIV treatment. U equals U stands for undetectable equals untransmittable. This means that if someone is living with HIV and undetectable for the virus, they have zero risk of transmitting HIV to a sexual partner. A lot of people also talk about this and call it treatment as prevention, because in treating HIV, we are also preventing HIV transmission. U equals U only holds as long as that person stays on their HIV medication. So if someone were to stop taking their medication, over time the virus would build back up in their body. They would be detectable and able to transmit. But as long as someone remains on their medication, it is impossible for them to transmit the virus to a sexual partner. So treatment also means that people are living with HIV and they are living long, healthy, happy lives. People are living into their 80s and 90s, and they may pass away from old age or something completely unrelated to their HIV diagnosis, rather than in the 80s and 90s when people were dying in their 20s and 30s and 40s. The only real drawback to HIV treatment is that it's incredibly expensive. So on average, HIV treatment can cost about $25,000 a year. I have to imagine it's gone up since I made this presentation. And so that's really adds up when you think about the fact that HIV is a lifelong diagnosis. But thankfully, we have financial assistance programs at the national level, at the state level, through health insurance plans that help cover the cost of really anything associated with an HIV diagnosis. So what this means is that people living with HIV can save their money, spend it on things that they want, if it's starting a family, buying a house, gifts around the holidays, really anything that anyone saves their money for. And so they're not only able to live long, healthy lives, but they can have really happy, meaningful, fulfilling lives as well. So I took up a ton of our time.
Perfect. You were so thorough.
Thank you all so much for having me. And I'm happy if there are questions to field those.
Yeah, so one curiosity is one of the myths surrounding HIV, and you stating that, yep, it's a human virus. What about that old myth that this originally came from animals or was from primates or whatever the misinformation may be?
Yeah, hate it. So there is a lot of information, misinformation, and myths about how HIV happened. Why did it just crop up in the 80s and 90s? And my best understanding and way to explain this is evolution. So people evolve and viruses evolve the same way. And viruses evolve to be effective. The goal of a virus is to get into a host and to make them sick. And so as humans were evolving, viruses evolved right along with them. And so eventually this virus evolved to a place where it was able to get into a human body before we ever knew it existed. And so then it started transmitting kind of very rapidly because we didn't know what it was. We had never heard of it. Sounds kind of familiar in the past 3 years. And if you think about it, there's a lot of parallels between COVID response and HIV and saying, it came from animals, it came from this, it came from that. Viruses do evolve to be able to jump species. So evolutionarily, HIV just developed to be what it is. But it did not necessarily evolve from people having any sort of relationship with animals, which is the big piece, the big myth that people love talking about.
Perfect. Thank you. Is there one more additional slide with some resources?
Yes, there is.
Potentially?
Let me throw that up.
Yeah, if you wouldn't mind. Because I also just wanted to, again, highlight that the piece where Mariah discussed needle exchange between folks if they're injecting drugs and sharing needles. BCAP provides syringe access services. You want to tell us about that?
Yeah, absolutely. So, very proudly, Boulder County AIDS Project is an arm of the Boulder County Public Health Works Program. So, our county public health has a works program or a syringe exchange, and we are a site of that at the Boulder County AIDS Project. So, Monday through Friday, we are open from 2 to 5 p.m., and we help distribute syringes and additional harm reduction and medical supplies, as well as provide information and testing services and referrals to other services like housing, food stability, transportation, medication-assisted treatment, mental health services, typically for people who are experiencing homelessness in our area, who are underhoused or non-housed. And so we distribute those materials in an effort to reduce the risk for HIV transmission as well as transmission of other illnesses like hepatitis C. So we are a site of the County Works program as well as mental health partners. And at the hub in Longmont, which is at 515 Kaufman, those are all additional sites of the County Works program. Boulder County AIDS Project, we are open from 2 to 5 p.m. Monday to Friday. Each of the sites has their own times. The one at Mental Health Partners is 24/7, which is really great, meaning we're only open from 2 to 5, but if somebody needs something at 9 a.m., there's a place where they can go and get it.
Yep, and worth mentioning, too, that it's in their part of their walk-in crisis center. So, 24-hour access for syringe access, as well as somebody who may potentially be in crisis or needing some addiction support services. There's also contact info for Pillar on that slide. Please feel free to reach out to us for any navigation support questions we can help answer. And if something can't wait and you need to speak with someone immediately, please call the Colorado or text the Colorado crisis line that's on there as well. And we are right just about 7 p.m. So that was the last question that we had. We will go ahead and wrap up and say a great big thank you to Mariah Frank and the Boulder County AIDS Project. Fun fact, I started my social work career with BCAP and they have such a special place in my heart. So we're very grateful for you and for BCAP and all the amazing staff there. And once again, just want to thank our community partners, Stone Cottage, who's been so wonderful this year, all of our speakers, everybody that's tuned in, our funders, the hospital. It's been a really fabulous 2022. So thank you, everybody who has supported us and this piece of our programming. And we will be back in 2023. We hope to see you all next year as well. We'll have probably some new speakers, maybe some repeat ones. We could talk all day about these topics. And hey, fill out the surveys. The link is right below the window here. It's a Google form. It only takes a few minutes. I want to know, what do you want to know about? This is for the community, and this is an effort to just bring more of this info to the masses. So I look forward to hearing back from folks. And once again, thank you to everybody involved in this. Have a wonderful, peaceful end to your year, and we will see you in the new year. Thank you.